I want to address a couple things. During the ranking member's opening statement, he talked about
Secretary Kennedy and the Trump administration continue to spread dangerous conspiracy theories about making it harder for Americans to protect their children from deadly diseases. I am having a hard time understanding how any of this will make America healthy again.
He talked about misinformation coming from this administration, and I just want to point out that the Biden Surgeon General, Dr. Murthy, was actually, a court actually ruled against him in 2023, the Fifth Circuit Court, for trying to censor free speech on social media. That's misinformation. And so for us just to throw out an accusation like that with no evidence when the ranking member was completely silent when that took place, it's really some hypocrisy there. When we start talking about healthcare not being affordable, the ranking member and I actually agree on that. The problem is you supported the same tools that got us to where healthcare is unaffordable, because ACA, affordable healthcare, which is completely unaffordable, has risen 3 times faster than inflation itself. Yet we still support it. Not we, you, the Democrats.
Now, I support a national health care program which will cut the cost of health care per person. But you're attacking me.
No,
I don't want any more Twinkie commercials.
You attack me, I'm going to respond.
I'm pointing out facts. You can say what you want. I'm just pointing out facts.
No, you're pointing out lies.
Is that it is risen 3 times faster, and we know it. Yet we still want to sit here and defend it. The ranking member wants us to talk about all the death that is supposedly going to be happening because of President Trump and Secretary Kennedy, because how dare they look at a healthcare system that is broken and unaffordable and try to make changes. But yet the definition of insanity is what? Doing the same thing, expecting different results, so we should just sit here and accept it? And how dare we look into...
I'm just curious to know what the death toll is of medical malpractice and people dying in hospitals. I'm just curious about that, if it's higher than 50,000 a year. I would say stay away from the doctor.
That's what I'm saying.
To just simply look to see if maybe a partial cause to autism when it's rising at a rate faster than any country in the nation. How dare us look at science? Oh my goodness. Science is supposed to be perfect. I thought science was always supposed to be studied. I'm for looking into it. As the father of 6 kids, yeah, I want to look into it.
Utah?
I want to know what's causing it. And I will turn over every stone. And so Dr. Means, thank you for saying I want to turn over every stone. Good on you. I'm not a doctor. I'm not sitting here trying to say we shouldn't do something. I'm saying let's go after it. Let's look at it. Let's question what we're doing. Let's look at the healthcare system. We can agree on that one. I just don't want to socialize it. But we can agree that it is absolutely not affordable. 100% not affordable. Yet it was supposed to be affordable. That's what we was sold by Obamacare. So how about we work together and say, hey, so scrap ACA, admit it doesn't work, admit you guys made a mistake, and let's work at something with President Trump to make affordable health care healthy and affordable for everybody. But there's 0 chance you guys could do that. 0 chance. Yet everybody we bring up here, you guys chastise for trying to make changes. God forbid we change and go after and try to fix our broken system. Anyways, I ranted too long. Let's talk about some...
Yes, you did.
I'm sorry, I didn't ask your opinion on that. And if I cared about your opinion, I would ask you. But I don't care about your opinion.
Well,
you're part of the system. You're part of the problem. You've been sitting here longer than I've even been alive. This is your problem. You should have fixed this a long time ago. You've been railing on it so long. What have you been doing?
I've decided not to run for Surgeon General. You're the nominee. I've decided not to accept that nominee.
That is definitely something we would never accept. Ma'am.
Caddy. Have they been married for 40 years?
Oh, great. I have not watched a lot with Senator Mullen from Oklahoma, but I kind of like him. He's becoming one of my favorites.
Yeah. Well,
I'm saying what we're all thinking here, guys.
What's your passion about healthcare? What brought you into this?
Thank you, Senator Mullen. For all of us, I'm just going to take a deep breath. My vision for Surgeon General and for the future of America is to get more healthy, whole food on Americans' plates and to work to systematically encourage our healthcare system to focus on the root causes of why we are sick and not just reactive sick care. This is my passion. This is why I was put on this earth. We have an incredible healthcare system. It's amazing. It's produced miracles. If we have an acute issue, absolutely you want to be in America to get that fixed. But 90% of healthcare costs are now going to chronic diseases. And frankly, having practiced, I've seen thousands of patients, worked in this system for almost a decade in clinical medicine, it's not the focus of what we as doctors are incentivized to spend our time on. It's not what's reimbursed, and this is a problem. Medical education doesn't focus on these modifiable root causes of diseases. The science is showing us through amazing emerging work in systems biology and network biology that the physiologic causes of the vast majority of diseases that are taking American lives and torturing and shortening our lives, even in our children, are connected by shared physiology and shared root causes. We need to upgrade the paradigm of the American healthcare system to educate and treat in that way. It is by far the most efficient way to treat, of course, because if we're addressing shared root causes, we're going to be able to stop the whack-a-mole medicine that's not working for us and that is so costly. And so my passion is to help work with the AMA, work with medical schools, work with Democrats, Republicans, all sorts of agencies across the government to ensure that we really move the needle on shifting the American healthcare system towards root causes. I know we can do it. There's political will. It's what Americans want. Even the medical schools are on board, but we need a vision to get there.
Thank you.
My understanding is you have come out against junk food ads on television. Is that correct?
Yes.
Can you just take 30 seconds to elaborate that? Would you use your position to ban junk food TV ads?
Thank you so much, Senator Sanders. And I agree with you completely. I think there is so much that we agree on these issues. Just to be clear, the Surgeon General's office does not have the purview to ban this.
But you have a voice.
Absolutely, and that's a voice I would absolutely lend to talking about the dangers of ultra-processed foods and getting these advertisements off TV. Right. This has long been a part of my message. I talk about it in my book.
Senator Marshall mentioned earlier ago the crisis we have in obesity, childhood obesity. And you have these manufacturers selling sugar-laden products that cause obesity.
Yes.
So you will speak out. And do I understand your view is you would fight to ban TV ads of junk food?
I like the Twinkies.
How can you outlaw like a Twinkie ad when you have big pharma ads every other commercial?
No Yankee Doodles.